This Xryliderm kit is used to help reduce itching and pain from certain skin conditions, such as scrapes, minor skin irritations, and insect bites. It may also be used to help relieve nerve pain after shingles, which is an infection with the herpes zoster virus. The main ingredient, lidocaine, belongs to a class of drugs known as local anesthetics. It works by causing a temporary loss of feeling in the area where you apply the patch. It is recommended to apply the patch to the affected area for relief from itching and pain. The daily dosage and optimal timing should be determined by a healthcare professional. When using this Xryliderm kit, make sure to carefully read and follow all the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This product should only be applied to normal intact skin. Do not apply to skin that is broken or irritated. The dosage is based on your medical condition and response to treatment. Remove the protective liner and apply the patch to the skin area that is most painful. Apply the prescribed number of patches as directed by your doctor, usually once a day. Depending on your product, the patch may be left on the skin for up to 8 or 12 hours. Follow the instructions carefully. Do not apply more than 3 patches once a day or leave any patch on for longer than the stated time period. If a smaller patch is needed, it may be cut with scissors before the liner is removed. It is best to avoid getting the patch wet since it may not stick to the skin. Some brands may be wet in water for a short time, such as showering for 10 minutes. Pat dry gently if you get the patch wet. Wash your hands well after each application. Avoid getting this medication in your eyes or mucous membranes, such as nose, mouth. If contact with the eyes accidentally occurs, wash your eyes right away with water and protect them until normal feeling returns. If your condition does not get better, or if it gets worse, or if you think you may have a serious medical problem, get medical help right away. Used patches still contain some medication. However, do not reuse them. Fold the used patch with the sticky sides together and discard it out of the reach of children and pets to prevent accidental swallowing or application. If you experience redness, swelling, blisters, or changes in skin color at the site of application, they usually go away within a few minutes or hours. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. If you feel irritation or a burning sensation, remove the patches and do not reapply until the irritation has resolved. Your doctor has determined that the benefit of using this medication outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Inform your doctor immediately if you experience any serious side effects, including blurred vision, changes in mental state, such as nervousness or confusion, drowsiness, dizziness, or an abnormally slow heartbeat. Seek medical help right away if you experience very serious side effects, such as pale/bluish/gray skin, unusual tiredness, shortness of breath, or a fast heartbeat. A severe allergic reaction to this drug is rare. However, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Before using Xryliderm Kit, it's important to let your doctor or pharmacist know if you are allergic to lidocaine, other local anesthetics, or if you have any other allergies. This kit may contain inactive ingredients that can cause allergic reactions or other problems, so it's essential to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have liver disease or a certain blood disorder called methemoglobinemia. While wearing the patch, it's best to avoid exposing it to direct heat sources such as heating pads, electric blankets, heat lamps, saunas, hot tubs, heated waterbeds, or prolonged direct sunlight. Heat may cause more of the drug to be released into your body, increasing the chance of side effects. If you are going to have an MRI test, it's crucial to inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. It's important to ask your doctor whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. During pregnancy, Xryliderm Kit should be used only when clearly needed. It's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Xryliderm Kit, it's important to be aware of potential drug interactions that could affect how the medications work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek your doctor's approval. This will help ensure the safety and effectiveness of your treatment. If the medication patch is chewed or swallowed, it can be harmful. If someone has taken too much of the medication, remove the patch if possible. For serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, slowed breathing, and slow/fast/irregular heartbeat. Make sure to keep up with your regular medical appointments and any necessary lab tests while using Xryliderm Kit. This will help ensure that you are getting the most benefit from the medication and that it is working effectively for you. If you are using Xryliderm Kit on a regular schedule and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. Remember to always follow the recommended dosage and timing instructions provided by your healthcare professional. Remember to store the Xryliderm Kit at room temperature and keep the patch sealed in its protective envelope until you're ready to use it. It's important to keep all medications away from children and pets. And when it's expired or no longer needed, make sure to properly discard the product according to the instructions in the How to Use section. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.